Hi, welcome to your January 31st through February 7th huddle. I'm Ricky, your nurse manager. Just a few things to cover with you folks this week. First thing I want to mention is that we have had a ton of isolations, which I know that you guys are all aware as you're putting on your protective wear, going in and out of rooms. This week, Patsy went over some of that information with our PCTs, but I'd just like to give you guys a reminder, if you're going into a contact room, that you're wearing gloves and gown. If you're going into a droplet room, really you just need gloves and a mask. I know there was some hesitancy about wanting to wear a gown while you're in that room. Absolutely, you should be doing that. If it is an airborne room, make sure that you're wearing your N95, wearing a mask, wearing gloves. Most importantly, doing some of the rounding, we have found that this is not being communicated to family and friends or visitors of patients, that when they're going into the rooms, that they also need to be wearing that protective wear. Please, 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 if you see a patient's family members or friends or company or whoever going in and out of that room, to make sure that you educate them on how to wear the appropriate PPE, how to take it off, that kind of thing. Especially, as you guys have heard, that C. diff seems to be running rampant. So making sure that you are washing your hands, that's even before you put on gloves. So anytime that you enter a room, make sure that you're using the hand sanitizer, putting on gloves. Before you leave, you're washing your hands. Going in, going out. Make sure that you're doing that. There are some folks that will be going around doing some auditing, so you never know who's watching you. Also, we, last week, I think it was, Kristen and Morgan and the folks from the Practice Council decided to tackle one of our little challenges, which is communicating with our patients what their side effects are with their medications. They have placed cards on each computer in each patient room that kind of gives just a generic what kind of medication might cause A, B, and C. So please make sure that if you notice, or anytime really is a good time, to make sure that when you're giving your medications, to ask the patient if they understand what they're taking as far as side effects and that kind of thing. And then you kind of just have that little cheat sheet there to kind of help you, so you know what medication might be causing certain side effects for that patient, and making sure that they really understand that, because that's important for them, and also that we are doing the very, very best that we can to give the best patient care. Also, we went live last week with the VMT house-wide. So I know that we are staffing that position, so there have been times that we're not actually monitoring patients, and that aide has been able to kind of help out on the floor temporarily, but make sure that we are championing the VMT position house-wide. So if we have a VMT who's not watching patients, I think the nice thing to do would be to call around to the units and see if they have any patients that might be appropriate, just to kind of get them used to having the VMT in-house. Because that will be a big help, especially if there's one-to-ones that could free up an extra body. We did have a fall last week. There was no injuries with that. I wouldn't say that there's any real lesson learned from that, but just again, make sure that when you're doing your rounds on your patients, that you're doing the safety checks as well. Yellow socks, bed alarms are on, chair alarms are on, that kind of thing, that the patient has their call light within reach. Sweet Styles, they sent out an email stating when our uniforms can be ordered. Those should be done by February 14th. If you haven't done that already, check your junk mail to see, you may have gotten an email. If you haven't, let me know. I've got a phone number that you can call so that you can get access to ordering your new scrubs. We also have Abby, who is helping us out on Fridays, Saturday, and Sundays from 3 p.m. to 3 a.m. on Fridays and Saturdays, 3 p.m. to 11 p.m. on Sunday. She is a light duty CNA from the float pool, but she will be kind of acting as our ward clerk, so we are so thankful for her help. If there's anything clerical that you need, please let her know. She'll be helping with that kind of thing. Just a reminder as well that CSC was approved through February 7th. And I also wanted to give a kudos out to Joey and Sarah. when I was doing reviewing our NRC picker, which is our survey results. They got kudos. And then everybody for the team, a couple of compliments that everyone, or the team did a great job, everyone did a great job, and that they gave exceptional care. So I'm going to turn it over to your charge nurse. I see I'm over my time here. If there's anything pressing that you guys need, let me know. Otherwise, have a great shift.